So let's look at some of the ideas behind the social security question. Consider the challenges faced by both the advanced and the developing economies in providing adequate social security coverage for their ageing populations. Now, although most countries have some form of institutional provision of social security, its provision in practice is often insufficient. The International Labour Organization, or the ILO, for example, reports that 3/4 of the world's population, that's around 5 billion people, are not covered by adequate social security. On the one hand, in advanced economies, social security provision is seen as comprehensive and universal. But on the other hand, in the least developed countries, especially the low-income countries in sub-Saharan Africa and South Asia, for example, only a limited number of contingencies are covered, and less than 10% of the population. And in between, the emerging economies are providing intermediate level coverage for a growing number of their population. If we turn to what's happening in ageing economies. Now, Japan is often seen as the classic ageing society. The steady rise in average income, combined with the introduction of social security in the 20th century, has led to an increase in average life expectancies, from a post-war level of around 60 to currently the highest in the world at 83. But their social security system now faces serious financial problems as the number of beneficiaries is increasing at a time when the working age population is declining. In other words, they're experiencing a simultaneous increase in payments and a decrease in revenues. The United States is also facing considerable budget deficits, in part due to its public social security and health programs. And future scenarios predict that the deficit will increase from between 8% to 20% of GDP by the middle of the century. The UK, however, is seen as being in a different situation, as there has been a continuous shift towards the older individual bearing the financial responsibilities of health and pension costs. Yet even here, the UK government has raised the pension age to 66 from 2016 in a direct move which will cut the UK budget deficit by some 13 billion a year. Indeed, reform to pension systems are now being adopted throughout the European Union in an attempt to reduce the impact of population ageing. And this includes things like the abolition or restriction of early retirement schemes, an increase in statutory retirement ages, and incentives to remain in the work for longer. But let's look at the kind of broad challenges that are going to be faced by both emerging and advanced countries. It may be argued that population ageing is going to necessitate a division between government responsibility, that's public money, to keep a population out of poverty, and individual responsibility, or private money, to raise the personal standard of living. Other challenges will also require consideration of frameworks which will support and increasingly encourage individual responsibility. And I think there will be two particular challenges which governments will face. How will they manage the expectations of relatively affluent upcoming cohorts of older adults who wish to maintain quality of life and health in later life, whilst also tackling the likely increasing inequalities between different income and asset groups in old age? So, both emerging and advanced economies are going to have to develop new policies in the light of population ageing, and these, it is argued, must include the development of broad, coherent and integrated multi-pillar approaches to labour markets, health and social security. They should enable and promote longer working lives through lifelong training, education and skills updating, and the provision of appropriate working environments for older workers. It's also argued that they should ensure that private family household transfers are integrated into old age security systems wherever possible, thus promoting well-being and enabling healthy active ageing to reduce chronic illness and health costs and support an active contributory life for as long as possible. It's going to be really important in both the emerging and the advanced economies that there is access to education across the life course, ensuring that all individuals will be prepared physically, mentally, socially and financially to cope with increasing individual responsibilities for old age.